Powered air purifying respirators, or Paprs for short, are used to protect the wearer from dangerous airborne substances. The TR300 Plus from 3M is one of a few different Paprs utilized at St. Mary Mercy Hospital. This video will discuss the setup and use of the TR300 Plus from 3M. Before using a Papr, you will need to make sure you have the appropriate supplies. You'll need the TR300 Plus unit, a battery, an airflow indicator, a breathing tube covers, and a hood. The first thing you'll need to do is take the breathing tube and cover it with one of the breathing tube covers. The cover is a long cylindrical plastic tube. You'll need to insert the breathing tube into the cover and pull it all the way through. When successful, take a twist tie and secure the cover to the tube at both ends. You should find the battery on the charger, remove the battery, and push the test button to make sure that the battery is fully charged. Attach the battery to the 300 Plus unit. Orient the battery so that the leads will connect, and press the battery until you feel it click into place. Power on the unit. The system will go through a self-check. All of the indicator lights will light up in succession. These represent the battery charging status, the filter status, and airflow settings. Airflow will always start on the lower setting, which should be sufficient for the altitudes of Livonia. But if you wish to increase the airflow to the second setting, press the power button twice. If the filter and battery indicators are all lit green, it means they are at full capacity. If there is only one light and it is red, it shows that the associated component is depleted and needs replaced. If the airflow indicator is illuminated red, it means the unit is not producing adequate airflow. You will also hear an alarm sound from the unit. Before you use the Papr, you will need to ensure that the airflow is high enough to ensure your safety. You will need to perform a quick airflow check using the airflow indicator. Attached to the indicator is a card that shows elevations. The elevation of Livonia is 206 meters. If you find that on the chart and match that with room temperature of about 68 degrees, it will tell you that you need to have the ball floating at least level E. Locate E on your airflow indicator. Insert the indicator into the hose port of the 300 Plus. Be aware that it can take up to 1 minute for airflow to stabilize. As soon as the ball floats above E, the unit is producing adequate airflow to protect the user. If after 1 minute it is not floating to the appropriate level, the unit is not safe for use. If your airflow is sufficient, insert your breathing tube. Take the end with the two metal knobs and insert it into the open port, and twist it clockwise. On the back of the hood, there's a port to attach the tube. Squeeze the ring and push the tube down onto the port. This should lock in place. It's now time to don the Papr. Your unit has a waist belt attached. Pull it around your waist and clip it into place. You may need to tighten the straps. Take your hood and pull it to completely cover your face. It is not necessary to wear a surgical mask under your hood. With this model of hood, your ears remain uncovered. When it's time to remove your hood, grab from the back near the hose and pull it away from your face. This ensures that you do not pull a dirty hood up across your face. When you are finished using your Papr, it will need to be cleaned. Using the gray top wipes, clean all exposed surfaces of the unit. Be sure to use a new wipe for every area. Remember to not only clean the unit itself, but also the belt, breathing tube, and mask. If the breathing tube is encased in a cover and the Papr will continue to be used during that shift, clean the cover and leave it in place. Finally, replace the battery on the charger.